Amlodipine is a blood pressure-lowering medication that is wide in its use. It belongs to a group of medications called calcium channel blockers. Shortly, they are known as CCBs. This medication is available as tablets in two strengths, 5 milligrams and 10 milligrams. In both of these strengths, amlodipine exists as its salt, vasodilate. It is also available as an oral suspension. Typically, amlodipine is started at a 5 milligrams dose given once a day. However, in a few people who are at greater risk of cardiovascular complications, it may be used at a 10 milligrams dose per day. It is very essential to know important side effects of this medication for a few reasons. First, it affects your blood vessels. Since many of the organs depend on how your arteries supply blood, amlodipine can influence the working of many organs in your body. Second, you need to use amlodipine for a longer time, several years to even a lifetime. This is important as a few of the side effects are rapidly developed and mild. However, a few other side effects need close monitoring, especially when you use this medication for very long periods. Third, amlodipine is a long-acting medication among the calcium channel blockers. This helps you take this medication once a day. However, it may remain in your body for longer periods and accumulate with repeated dosing. This can bring a few side effects after several months of use. Therefore, before using this medication, you should be aware of possible side effects and how to manage them. In this video, we will cover such key points in detail. First, let's see what's the purpose of amlodipine. Amlodipine can be given to you for two main purposes. If you have hypertension, it can make your blood vessels hardened, offering a great resistance to blood flow. This can increase the risk of heart attacks and strokes in the future. Amlodipine can be given to you if you have elevated blood pressure. This medication causes dilation of your blood vessels. This helps in reducing your blood pressure and improves blood flow. Another indication of amlodipine is in the treatment of angina. When the blood supply to your heart is reduced, it gives you an alarm in terms of pain in the heart. You may have a pain in the left side of the heart that propagates to the shoulder and neck. Amlodipine can improve symptoms of angina due to dilation of arteries supplying to the heart. This improves blood and oxygen supply to the heart cells, leading to improved cardiac function. In both of these indications, the role of amlodipine is the same. It blocks the contraction of arteries that results in dilation of blood vessels. Calcium is required for contraction of blood vessels, and it is released by voltage-gated calcium channels. Amlodipine blocks these ion channels, thereby preventing contraction. However, the same effect of dilation of blood vessels can bring a variety of side effects. Let's explore one by one. We will discuss the side effects in the order of their frequency and severity in many people. The first one is the peripheral edema. This is the most common side effect observed in many people with use of amlodipine. It can cause swelling of your ankles and legs. This incidence of edema is dose-related and more pronounced at higher doses. You can observe almost 3 times more swelling at the 10 milligrams dose compared with a 5 milligrams dose. Amlodipine dilates your blood vessels. It brings widening of very tiny pores on them, increasing permeability. This prompts the escape of more fluids from the capillaries to surrounding tissues, leading to their accumulation. Consequently, blood vessels supplying your legs and ankles bring swelling. Raising your legs while sitting can lessen the swelling. Gentle massage and soaking feet in warm salt water can relieve edema to some extent. Avoid sitting or standing for longer periods. Normally, leg edema can be treated by using medications called diuretics. They increase excretion of excess body fluids that may be observed with heart failure or kidney failure. However, the leg edema produced by amlodipine is not due to excessive fluids in your body. It is mainly due to dilation of blood vessels that cause accumulation of fluids locally. That's why diuretics may not be effective in a few people for treating amlodipine-induced leg swelling. Interestingly, edema is mild in many people and well controlled by physical methods. However, in cases of significant edema observed with the use of amlodipine, your doctor may prescribe a low dose of amlodipine combined with other blood pressure-lowering medications like ACE inhibitors or angiotensin receptor blockers. Another side effect is dizziness. You may notice this side effect with the first few doses of amlodipine. You may feel dizzy and lightheaded. You may have a state of sleepiness and feel a little drowsy. These effects are generally common with medications that cause dilation of blood vessels in the brain. Due to a drop in blood pressure in the arteries, people may experience dizziness and confusion. Fortunately, this side effect produced by amlodipine is mild and seen only in the initial days of therapy. Dizziness slowly weans on continuation of amlodipine. However, if you feel more dizzy and drowsy, try to avoid suddenly changing your posture. The next side effect is fatigue. Use of amlodipine can make you feel tired and weak. This is common with many vasodilators. The extent of tiredness doesn't depend on the dose you are using. Therefore, this side effect may be observed at any time during the course of therapy. Few other medications and coexisting conditions like diabetes may also increase fatigue. However, excessive tiredness is rarely observed. Fatigue can be controlled by maintaining a healthy diet, rich in fresh vegetables and fruits. Controlling high-calorie intake of foods and proper physical activity can reduce this incidence. Palpitations. Even though amlodipine does not act on your heart, it can still affect its response. You may observe rapid heartbeats with the use of amlodipine. The reason is simple and commonly observed with many medications that act directly on blood vessels. Amlodipine reduces blood pressure by dilation of arteries. This reduces the perfusion pressure of blood into organs. To compensate for this low perfusion pressure, your heart tries to contract at a higher rate. This results in pounding hearts. Sometimes you may feel a few heartbeats are skipped. This side effect increases with the dose you are using. Women may experience it more frequently than men. Flushing. Amlodipine can cause dilation of arteries supplying our skin. This improves blood flow to the skin and may increase redness. You may experience facial redness with use of this medication. The incidence is more observed in women compared with men. Abdominal pain. Few people may experience nausea and abdominal pain with the use of amlodipine. However, it is very mild and may cause discomfort for a short period. With long-term use, your body adjusts to this medication, and abdominal pain may disappear. However, a severe abdominal pain may indicate any other dysfunction in your body that is not related to amlodipine. Somnolence. Somnolence is another important side effect that may be observed in many people. It can cause sleepiness in the daytime. Lack of energy, dizziness, and drowsiness may further induce this condition. This side effect is equally observed both in men and women. Low blood pressure. One of the main indications of amlodipine is to reduce your blood pressure. However, this drop in blood pressure may show more effect when you change your posture. This effect is called postural hypotension and is rarely observed with amlodipine. However, in a few people, lightheadedness and dizziness can be observed while standing. This effect can be observed if you are using other blood pressure-lowering medications along with amlodipine. This may increase the risk of sudden falls in people. Therefore, if you observe any severe hypotension, talk with your doctor to adjust the medications properly. Headaches. This is one of the common side effects observed with amlodipine. This medication causes dilation of cranial blood vessels that elicit pain by stimulating sensory receptors in the brain. Consequently, you may experience headaches. However, it is mild and well tolerated by many people. Headache may slowly disappear on continuous use. Gingival hyperplasia. It was found that amlodipine produced proliferation of gums in a few people. This condition is called gingival hyperplasia. This side effect is not observed in all people and is only found in a certain group of people. Such types of reactions are called idiosyncratic reactions. Other side effects. The development of skin rashes may be observed with use of amlodipine. A few other side effects are also observed that are not directly related to this medication. However, they may be enhanced in the presence of amlodipine. A condition called rhabdomyolysis is linked with the use of statins at higher doses. It may cause pain and muscle weakness. The risk may be further increased when statins are combined with amlodipine. However, this side effect is not significant when amlodipine is used alone. These are the common side effects of amlodipine that you should know before its use. That's all, guys. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.